Hello, my name is Lauren, and this is the Insulin Administration video for Nursing 400. The date is the October 28th, and it is 1:11 p.m. To start, I would clean my hands and put on some gloves. Here on this paper, I have the different orders for the no-vlog pen, regular insulin, and NPH insulin, the units for it. So for the no-vlog pen, I'm going to give 5 units. And prior to administering, I would spin the insulin pen in my hands about 10 to 15 times. I wouldn't shake it or anything like that. And then I would use an alcohol swab to clean the tip of the pen. Okay. And then I would attach the needle. Okay. And then I'm going to go ahead and prime 2 units. I would turn the knob on the end to 2 units. Take off the cap and prime 2 units. I'll go ahead and recap. Okay. Then I will go ahead, whenever I get to the patient's room, I would pick a site for administration. Depending on the last site that was used, or just by looking at the skin, I would rotate my sites. So if they got it on the left side last time, I'll go ahead and do it on the right. So we'll do it on the right this time. I use a swab to clean the patient's skin. I will let it air dry as well. And since we're given 5 units, we'll go ahead and turn this knob to the 5, between the 4 and the 6. 5 units. Okay. And then I could, depending on the amount of fat tissue my patient had, I would have to squeeze their stomach. I would go in at a 90-degree angle or 45-degree angle, depending on how much adipose tissue I had to squeeze. Administer, push the knob down and hold it for about 10 seconds. Okay. Remove the needle. Then I'm going to go ahead and cap it again. And then I would discard in a sharps container. That was either in the patient's room or in the med room. So I would discard it in a sharps container. Okay. And then now for administering insulin through an insulin needle, I'm going to give regular insulin and then the NPH insulin. So I would clean the tips of the medicine vials. Okay. And then we need 8 units of cloudy insulin. So I'm going to go ahead and draw 8. And then prior to pushing the air out of the syringe, I'm going to make sure I rotate my vial as well. So I'll rotate 10 to 15 times. I would do it for each one. Okay. So I'm push 8 units of air into here, into the cloudy. Okay. And then 4 units into my regular insulin. I would draw back on the needle. And draw 4 units. Then I would make sure I get any air bubbles out as well. And then I'm going to go ahead and draw the 8 units of my cloudy insulin. And the total of 4 units and 8 units between both insulins will total out to 12. I'm going to cap it for now. Okay. And there's the 12 units. Okay, we got 12 units. And then I will go ahead and go to my patient's room. Depending on the last site used, I will make sure to rotate sites as well. I would also verify my orders as well with the patient's blood sugar and their sliding scale. I would let that air dry. Then I would pinch the skin and administer at a 90-degree angle. Administer insulin. Okay. And I will discard this in the sharps container. And I'll be sure to monitor the patient's blood sugar and just observe their signs and symptoms.